this afternoon. The topic of this year's pre-conference is very important and relevant, and I'm happy to see different organizations within UN, like WHO, Stop TB, UNS, with communities together. This is the aim, I think, of this topic this year. And in my own language, we say, that means that one hand don't upload. We need two hands together. So we need all those who are involved in an issue to be together, to be sure to come and to address it correctly. So I have a PowerPoint presentation that had to bring us for 1 hour, but I just heard that I have 20 minutes, so I will manage the time, reframe my time to try to say what I have to say in shorter time. The main aim of my presence here is to show, to talk to you about the permanent forum and to say how it's important or how we can partner with a permanent forum on indigenous issues. So what is the permanent forum on indigenous issues? The permanent forum is an advisory body within the ECOSOC, which has 6 mandated areas. One of them is health, but the others also are health determinants. So we were talking about colonization, decolonization this morning. It's one of the determinants of health. So if we talk about, if we see economic and social development, culture, human rights, education, environment, they are all related to indigenous people's health. We provide expert advices to UN system as well as all other stakeholders working with indigenous people. So it can be UN agencies, states, or academics. We also promote the rights of indigenous people around the world, and today this is one of the things that I'm doing to talk about the rights of health in Amsterdam. The Permanent Forum is composed with 18 members. We have 16 members, sorry. We have 8 nominated by indigenous peoples and 8 and then appointed by the chair of ECOSOC. I'm one of those 8 ones. And we have 8 elected by the ECOSOC president, but designated by states themselves, the governments. The Permanent Forum focuses its work on different areas and which are interrelated. We can't put them in separate boxes. For me, when I talk to, as I said earlier, when I talk about indigenous health, I'm talking also about how they enjoy their culture, how they are in terms of housing, etc. So how they take decisions also, all these things affect their health. So there are lots of thematic focus which are related to our health, but a specific one on health is under access to basic services. So there we talk about healthcare specifically. So we have the Permanent Forum, but I would like also to, because we used to forget the other mechanism on indigenous issues, we have the special rapporteur on the right of indigenous people, and she has the mandate to visit countries, to conduct studies, and to deliver also official communication on any concern on indigenous issues. The third one is the expert mechanism on the right of indigenous peoples, and this is a subsidiary body of Human Rights Council in Geneva. I just came from the session. They have annual session in Geneva, and they are more human rights based. But as health also is a human rights issue, we were talking about that all this morning. So they have a particular attention on health rights, on the right to health. And 2 years ago, they conducted a study on indigenous people's right to health. And now this study is an official UN document that you can find on their website. So, talking about indigenous people's rights, there are several international instruments that protect indigenous people's rights. And the first one, and I will say our Bible in that, is the United Nations Declaration on the Right of Indigenous Peoples. That is a widely adopted document. It's universal. It has been adopted in 2007, and by 2010, all the countries were adopted the UN Declaration on the Right of Indigenous People.
Yeah.
So these are some of the rights enshrined in the declaration, but I'm coming to this one, which is interesting to us today, is the right to health. And within the United Nations Declaration on the Right of Indigenous Peoples, it stated that indigenous people have the right to their traditional medicine and to maintain their health practices, including the conservation of their vital practices, vital medicine plants, animal and mineral. Indigenous individuals also have the right to access without any discrimination all social and health services. So this is how the right to health is enshrined within the United Nations Declaration on the Right of Indigenous People. And then we have the 2014 World Conference on Indigenous Peoples, because after 7 years after the adoption of the declaration, we noticed that there is still gap in implementing effectively the declaration at country level. We see a lot of commitment at international level, but when we go to national or ground level, at the community level, even in some communities, the UN Declaration on the Right of Indigenous Peoples is not known and it's not filled. So in 2014, we had the conference where states committed again to protect indigenous people's rights, and by giving some concrete steps, next steps like building national action plans, enhancing participation of indigenous peoples at United Nations, not as NGOs, but as indigenous institutions, parliamentarians, chiefs, etc., not like it is now as NGOs. And also the UN system launched in 2015 after the World Conference, the SWAP, the System-Wide Action Plan, which is a tool that has to harmonize the United Nations agencies, programs, and funds with UN Declaration on the Rights of Indigenous Peoples. So within the SWAP and the outcome document of World Conference on Indigenous People, there is a clear reference to Indigenous people's health, particularly to AIDS and malaria, as well as tuberculosis. Now we have the UN GRIP, but there are other international instruments before the UN GRIP. For example, the ILO Convention 169 that call for adequate health services for indigenous people, health services that are community-based and healthcare system that shall be given by indigenous peoples themselves, that like health workers should be indigenous persons. And finally, the last one is the 2030 agenda that has been already introduced by both my colleagues from WHO as well as Michel Sidibé, where the states committed to, by 2030, end the epidemics of AIDS, tuberculosis, and malaria with over communicable disease. And for indigenous peoples, there are a specific constituency for the follow-up of the SDGs. That constituency is among the 9 of civil society. It's named Indigenous Peoples Major Group. And we should work with that constituency to be sure that the SDG 33 is implemented, and how we can change the trend for the SDG 33, because it's not reviewed this year. It was reviewed last year, but as we said for SDGs, even if one SDG is not on a review, we can call states on these SDGs, because the 17 SDG goals are always relevant to be reviewed each year. So now, concretely, to come to the aim of this presentation is how to engage with the Permanent Forum. So the Permanent Forum organizes each year an expert group meeting and an annual session in New York, and we have more than 1,000 attendees from all the world and from all the fields, like indigenous communities themselves, UN system, states, and at all levels. We have a very high level representation there. So you can bring your issue to this expert group meeting or annual session, but you can also, as some of you already do it, you can approach a specific member of the Permanent Forum to try to move any issue. For example, Trevor and me were, Trevor is good in doing that. He was working with me, trying to push for the issue of AIDS, HIV and AIDS. And now, depending on the issue that you bring, we can reflect it in our annual report or at the report of EGM itself, we had that kind of collaboration with Clive when he participated to an expert group meeting that we organized on sexual and reproductive health 4 years ago, I think, yes. And or at the annual session, within from the statement that Trevor gave at the plenaries, I jumped on these recommendations and reflect them on the final report of the Permanent Forum annual session. But then, after getting the recommendations or an analysis within our report, what happened to these recommendations? They can stay just as database or information for UN agencies, programs, or academics as background information or for those or states, but it can be followed and put in real projects. So that's what we are trying to do, but sometimes it comes by itself. For example, with FAO, we made some recommendations that we framed together. We know that it will bring a specific policy, specific meeting to prepare a policy, but sometimes it has no, it is not heard. So we need more efforts. For example, when we address a recommendation broadly to WHO, sometimes it stay, I'm sorry, but it stay without any answer. So for a follow-up of our recommendation, we need sometimes we have a response for those who it's addressed to, but sometimes it's made by the community person or the person who made the recommendation to follow us, to follow up the recommendation on and to try to build bridges with different partners to follow up the recommendations. So that is how we work usually at the Permanent Forum. So thank you for listening to me, and I'm very happy to address you, and I will be happy to answer to any questions, concern about the work of the Permanent Forum, but about also Indigenous people's health in general. Thank you.
If you could stay up on stage, Mariam, we have a gift for you.
Yeah.
Mariam, we have a gift for you.
Maar come on stage, you don't see it?
Yeah. Photo opportunity here. Thank you so much for the work you've been doing at the Permanent Forum, especially for HIV and TB, Mariam. Thank you.
Thank you so much.
Yeah, IGWA has been working at the United Nations Permanent Forum on Indigenous Issues and at UNAIDS, because UNAIDS, they weren't used to talking about Indigenous peoples, and the Permanent Forum, they're not so used to talking about HIV. But when Mariam and Michelle got together, they realized they're from the same village in Mali and speak the same Indigenous language. So we have a good connection there. Thank you. You know, at our pre-conference in Durban 2 years ago, we were honored to have the Minister of Health from Canada, where most of our funding comes for our working group. This year, we have the honor of welcoming Dr. Thomas Wong, who's the Chief Medical Officer of Public Health and the Executive Director for the Office of Population and Public Health of the First Nations and Inuit Health Branch of Indigenous Services Canada. He was trained in family medicine, internal medicine, infectious diseases, and public health at McGill, Harvard, and Columbia. His public health work includes engagement with Indigenous communities, HIV, hepatitis C, sexually transmitted infections, tuberculosis, influenza, vaccine, preventable diseases, antimicrobial resistance, chronic diseases, let me catch my breath, mental health, addiction, and health disparities. Dr. Wong sits on multiple national and international committees and has academic appointments at both the University of Ottawa and the University of Toronto, and he is a good friend of many Indigenous peoples. Come on up here, Thomas. Welcome.
Thank you. Always a pleasure. First of all, I want to actually thank everyone in this room for your warm welcome. And first of all, I'd like to begin by acknowledging the traditional knowledge in this room. And it is a great privilege to be in your presence here today. And to quote Mariam from the Assembly of First Nations, nothing about us without us. This is something that's so close and dear to my heart. And before going any further, I'd like to also thank the International Indigenous Pre-Conference organizers for inviting me to share a few thoughts this afternoon to launch this week's amazing event over the next number of days. It's a great honor for me to have been asked to address such a renowned group here in this room who have been working towards the common goal of eliminating AIDS as a public health threat in Indigenous communities around the world. And I congratulate all of you on the important work that has been done so far and your ongoing efforts to increase the visibility of Indigenous peoples, to closing the gaps, as Michelle said earlier, specifically within the context of this year's International AIDS Conference. To touch upon this year's pre-conference theme, building bridges, uniting the strengths of Indigenous peoples, it's been exciting to see that in 2017, the launch of International Indigenous HIV/AIDS Community Organization, in conjunction with the 16th United Nations Permanent Forum on Indigenous Issues. It's been a historic development, as Mariam had actually said. I would also like to acknowledge our long-term partner in this room, the Canadian Aboriginal AIDS Network, for supporting the ongoing work of International Indigenous Working Group on HIV/AIDS, leading to the launch of IAC. We value the work of Canadian Aboriginal AIDS Network and other Indigenous partners on a number of initiatives that promote greater awareness and strengthen the response to HIV/AIDS, other sexually transmitted and bloodborne infections, and TB. My perspective on HIV/AIDS has been shaped by my own experience as a physician. In my clinical and research work, I've seen the devastation over decades of HIV/AIDS and TB on individuals, on children, on families, and on communities. Unfortunately, health disparities continue to disproportionately affect Indigenous peoples in Canada and around the world, and it makes my heart break. This year's theme is a powerful reminder that we must continue to do even more to enhance the meaningful engagement with Indigenous peoples, break down the barriers of stigma and discrimination, and improve access to culturally safe health and social services. Coming together on the world stage to share wise practices and innovative approaches against HIVs, other STDIs, and TB is a great opportunity to showcase the leadership of Indigenous peoples and organizations around the world. It is important to acknowledge that Indigenous peoples in Canada have suffered for too long the intergenerational trauma from the loss of connection to the land, culture, language, and traditions as a result of colonial practices like relocation, reservation systems, and residential schools. We know that Indigenous peoples in Canada continue to be affected by major health problems at much higher rates than non-Indigenous peoples in Canada. In a renewed nation-to-nation relationship with Indigenous peoples in Canada based on self-determination and human rights, the Government of Canada created a new Department of Indigenous Services Canada. And this new department aims to better meet the health and social determinants of health of Indigenous peoples in Canada, to accelerate self-determination, contribute to addressing gaps, and advance actions towards truth and reconciliation. Moving forward, our new department will continue to enhance access to high-quality services that are delivered and led by Indigenous peoples to improve socioeconomic conditions, quality of life, and safety in communities. Improving health outcomes requires Indigenous-centered services, not services that's led by governments. Focus on community wellness and culturally grounded services that link effectively to existing provincial and territorial healthcare systems. This includes supporting community-led, community-driven, integrated approaches that enhance prevention and community capacity, as well as increasing access to quality diagnosis, early detection, care, treatment, and support. An example is Saskatchewan community, and you heard Michelle said that earlier. It's a project that's been highly community-driven, community-determined, supported by governments. It's called Know Your Status Initiative. That will be showcased at the Canadian Pavilion during the May conference. And I urge you to go and visit the Canadian Pavilion when you have time. There is increased recognition of Indigenous knowledge, determination, and resilience rooted in various traditions and cultures. This will be highlighted in the event held over the next few days. To conclude, this recognition is essential to end AIDS as a public health threat to Indigenous communities by 2030, and to ensure that no Indigenous people are left behind. Thank you.
Thank you, Thomas. Thank you very much. And I think we have a gift for you, Thomas.
Yes, we do.
Come on up. These are our keynote speakers. Michelle, Mariam, and Thomas. Thanks again, Thomas. I'm going to pass it over back to our MC, who will facilitate a bit of question and answer. Thanks, Denise.
Of course.
So thank you for your presentations. I'm so happy that we were able to get many different levels. And yes, do you want some?
Cuando hablen despacio porque se lee un documento muy rápido y la traducción.
I'm going too fast. Oh, we're all going to.
Everybody.
So we need to.
Para los traductores.
Okay. So just as a note to maintain a different tempo, a different rhythm. So I'm wondering if we have any, if you'd like to perhaps have a couple of questions. Is that okay? If there's any questions? Is there anybody that would like to direct questions to either of our two presenters? So we'll move around.
Mira. Muy bien. Miriam, quiero preguntarte sobre un tema que es muy recurrente, por lo menos en lo que yo conozco en América Latina, y que he visitado muchas comunidades a partir del trabajo que hacemos. Cuando se aborda el tema del VIH, la sexualidad y los derechos humanos, y nosotros colocamos el tema de diversidad sexual, muchas veces en nuestras comunidades se niega la existencia. Evidentemente que hay un impacto del colonialismo como el proceso de negación. El foro permanente, ¿cómo está abordando el tema de la diversidad sexual en las comunidades indígenas, y cómo está intentando romper esas barreras también para no seguir negando esas realidades.
Okay, I have a question for Mariam. The theme, the subject that you mentioned is quite a diverse, at least in Latin America. I have visited a lot of different communities, and you are talking about HIV, about sexual rights, human rights, and what is important in those communities is also sexual diversity. And it seems that in our communities, it is hardly possible to exist when you have sexual diversity in those communities. Of course, part of it is colonialism, and that's part of the problem. So my question to you, as a member of this permanent forum, is how do you think it's possible to break those barriers and to try to improve things?
Thank you for your very representative question. Indeed, the issue of recognition of sexual diversity is also put on table at the Permanent Forum on Indigenous Issues. I think Clive was there in 2014 when we organized an expert group meeting on the theme of sexual and reproductive health. This was one of the topics that has been discussed at this stage. We had reframed with Indigenous people who attended the meeting some recommendations, but I agree with you that there is still more to do to achieve to go beyond this taboo. I call it taboo because in lots of communities, because of the legacy of colonialism, of several kinds of colonialism. For example, to our region, it's the religious colonialism, like we have been colonized by Muslim people, by Muslim, so that made that a third gender is not allowed, but in our culture, the third gender is not only allowed, but it has a special position within the community. So again, to bring the attention on that concern, for me, it goes in the box of self-determination also of indigenous people. And I think that that theme of that concern has to be more and more bring by indigenous people at the permanent forum, not just once at one meeting and then we close the door. We have to follow up on it and to hear it. You have to, in French we say casser les oreilles. You have to repeat it, and repeat it. Then we can at least rise at higher level. But still, within the permanent forum, we know there are a lot of political issues also. We sometimes want to raise some issues that are not allowed by some states, but I do encourage you and other indigenous people from all over regions to come with that issue, and we will be sure to echo on it within our work at the Permanent Forum. Thank you.
Perdón, Miriam, yo quiero hacerte una propuesta. Perdón, una propuesta muy concreta. y lo venimos trabajando en América Latina. Pensamos que una estrategia importante de visibilidad es a ver si pudiéramos trabajar de manera conjunta con el foro permanente sobre la creación de una etnocartografía de diversidad sexual y de género, por lo menos que identifique dónde estamos. Con eso creo que pudiéramos empezar a visibilizar, a nombrar.
I have a very concrete proposal for you, Mariam. Something that we've been working on in Latin America. We feel that we should develop a strategy on visibility. So we together with the permanent board and try to map out like a sort of cartography, the sexual diversity, gender diversity, to identify the different types of situations. So that we know what the situation is and how everything is working out in the different communities. That will be the proposal. Thank you.
One last comment, just so you know where we're at. We'll take one last comment, a final brief question. And then as that's going on, we have to get the rest of the speakers to start moving to the stage for the next.
Within the permanent, this is a very good idea, and this is what we really like to have complete situation. As Dr. Wong said, nothing for us without us. So this comes from the community, from people who know it better, the community. And within the work of the permanent forum, that is doable because every 3 years the permanent forum has to write a document named State of Indigenous Peoples around the world, and we can reflect the situation, for example, of the diversity of gender of indigenous people.
Oh, thank you. Okay, so the last question.
Thank you. My question is for Dr. Wong. I'm a Mi'kmaq scholar from York University. I just finished my doctoral research. I'm looking at HIV funding for Indigenous communities across the country. And so I found that there's no federal policy that actually dictates funding for HIV services. And what I actually found is that in the province of Ontario, the federal government has decreased their funding 0.04% over the past 3 years in each of the years, while the incidence of HIV in Indigenous communities in Ontario has increased on an average of 2.4%. And through this research, we found that people are being forced out of their communities in order to access care, treatment, and services, and even basic testing. So my question for you is, will Canada ensure that there's a dedicated funding envelope or a dedicated policy around funding for First Nations communities in Canada?
Thank you so much, for your question. Without sufficient amount of funding, especially in remote and isolated areas, it's one thing if you're fortunate enough to be actually living in big cities like Amsterdam or Montreal or Toronto in the context. In remote areas, it's very hard to actually access services. So for that, the government of Canada recently has actually announced the additional investment of $37.5 million over 5 years, specifically to increase services, HIV and other STD services for Indigenous people in communities. So I'm very encouraged about that. However, I think that we should not forget that's just a start. We need to do even more. Thanks.
So again, thank you for your presentations. And I'm going to actually turn the microphone over to Clive, and we will get our next section of the presentation. So warm thank you for our two presenters that are still with us.
And I would like to invite Jane